Doctor here. I had one a few months ago sent into the hospital by his primary care doctor with shoulder pain. He said he felt absolutely fine, just a really uncomfortable right shoulder pain that hadn't gone away for a couple of weeks. He maybe felt a bit more tired than usual and oh, come to think of it, had lost quite a bit of weight recently and none of his clothes fit him anymore. I went to examine him and had what we describe in the profession as a heart sink moment. He was jaundiced and his abdomen was absolutely solid in the right upper zone from a huge, craggy liver. Get him in the CORT scanner and he is just full of cancer everywhere. Couldn't even work out which was the primary. The shoulder pain is what we call referred pain and is commonly caused by diaphragmatic irritation, in this case from all the liver masses pushing against it. Bless him. I think about him a lot. About 10 years ago I was helping in the fast track area of a suburban ER. This is usually for uncomplicated stuff, lacerations, headaches, twisted ankles, etc. Triage nurse sends back a 70-year-old man with back pain who had been raking leaves all day. She figured he'd just need a muscle relaxer and maybe some pain meds and be out the door. Palpating his back didn't elicit any tenderness, not a big deal. Decided to do an abdominal exam, and he had a large pulsate mass in his abdomen. Turned out to be a 14 cm aortic aneurysm that hadn't yet ruptured. Vascular surgeon came in at 10 p.m. begrudgingly and saved his life. Earlier this week I did an ultrasound on a middle-aged woman for yearly screening for ovarian cancer as it ran in her family. She has no symptoms. We typically only look at the uterus and ovaries on a pelvic ultrasound, but while imaging I noticed she had a bladder tumor. I imaged that as well, and after she was sent to a specialist. She came into my department yesterday to thank me. She was crying. She had brought me a card and wine and chocolate thanking me for finding something they didn't know to look for. Ultrasound tech, not a doctor. Doctor here. My clinic is in an interesting area, so I have a ton of stories. But this is the most recent I can think of. I had a patient come in for an annual physical. She hadn't been seen in a long while, like 15 years, but decided it was time to come back in and get checked out, just in case. Huge red flag. Through the interview she's insisting everything is fine, no complaints in particular, maybe some weight gain but nothing unexpected. Then comes the physical. I can barely hear her heart sounds. I swear she's got a heart rate of like 10. Lungs sounds like crap. Get to her legs. She's obese, but her legs seem weirdly huge for her size. Try to lift up her pant leg. Can't. Too tight. She has to pull her pants down, at which point I see she has ace bandaged both of her legs from ankle to thigh, and her feet are black and ice cold. They are dead and gangrenous at this point. I unwrap some of the bandage, and her shins are blue. I'm freaking out at this point. She tells me her legs swell sometimes, and started turning blue a couple of weeks ago. She heard wrapping, was good for that, so she's been doing this for weeks. It really hurt her feet in the beginning, but now she can't feel it, so it must be working. So with much protest, I finally get this woman to the ED bedside. Ultrasound of her heart shows it's basically completely failed, but she's somehow still alive. Ends up in cardiac ICU, required both feet partially amputated, and a device placed to help her pump blood forward. Good news is she survives. I see her back like 3 months later. She still doesn't understand what the big deal was. I was doing fine with my wraps. Begrudgingly took her medications, and actually got enough function back that she didn't need a transplant. The human body is amazing. Orthopedic surgeon here. This is some of the stuff of nightmares for us. A young relatively healthy patient, 28-year-old guy, came to our hospital for an MRI of his lower abdomen and pelvis after a persistent core muscle injury, sports hernia. These are typically things that heal pretty well if you just rest and take it easy. Sometimes, very rarely, they need surgery. He was being worked up by a physician not associated with us or the hospital at all. It was just the most convenient place for the guy to get the MRI. So, he's in the machine. Probably miserable because it takes forever and is loud and banging, and just the fact that going to do anything medical sucks. To get the right pictures, the technologist moves him in and out a few times, taking different sequences of images. This particular tech is pretty experienced and sees something that looks off. He calls the radiologist to quickly look through the images to see if wants more / different images. The radiologist immediately called our team. There was a huge mass in this guy's pelvis right around his hip joint. This is not an area where you get a lot of benign tumors in young people. We quickly look through the MRI. Meanwhile, this guy is lying on some bed staring at the ceiling, wondering when he'll be done and can get back to work. We go and talk to him at length about what we are looking at and immediately have him admitted for an expedited workup of what we think is sarcoma, particularly some kind of chondrosarcoma. He agrees, is freaking the hell out and visibly shaken by what's happening, gets admitted and has a biopsy done the next day along with a full battery of tests to help us know what this is and to see if there is any evidence of tumors anywhere else in his body. A week later, our suspicion of chondrosarcoma is confirmed and he's scheduled for surgery. The type and stage of his cancer is not one that responds to chemotherapy or radiation. His best chance is surgery. A very big surgery. He undergoes an internal hemipelvectomy with a complete reconstruction of part of his pelvis and hip. He was in hospital for about a week and inpatient rehab for about 2 weeks after that. 3 years later, there's no sign of recurrence and he walks without a cane. He's not very worried about his sports hernia anymore. TLDR. Guy went for an MRI for a gnawing injury, got diagnosed in the scanner and immediately admitted and ended with pelvic resection / reconstruction for sarcoma. ER nurse here. Had a guy come in complaining of weakness. Lots of people have this. It's a pretty generic complaint and a lot of the time isn't too worrying. Could be fever, migraines, something minor, etc. I took one look at this guy and said, oh, shit. To this day I can't tell you what it was about his presentation, but I knew something was horribly wrong. I rushed him back to a room and sent another nurse to get a document. I started putting him on the cardiac monitor and starting and forth when he coded. Literally walking and talking just moments earlier. We got him back quickly and immediately started running blood tests. The guy had a stage 4 splenic laceration that had been bleeding for over a week. He had no idea how he injured his spleen. He hadn't encountered any recent trauma, but basically we ended up intubating him and then running a massive transfusion. Google the Belmont infuser if you're curious, to replace so much of the blood he'd lost. He was transferred to a different hospital, so I never found out if he made it. But literally as we tried to explain to him that he was very sick, he was like, yeah, I get like this sometimes. Pretty sure you've never had a bleeding spleen before, bud? Not a doctor, but I've got 2 stories where I thought I was fine / being ridiculous over the whole thing. First one, I thought I had really bad period cramps which kept getting worse to the point I couldn't walk. Turns out I had an ovarian cyst burst on me and I spent 6 hours in the waiting room, hunched over in a wheelchair, because the nurses thought I was just trying to get out of school. Second time, I just thought I had a sore throat, did the strep test and everything, which came back negative at the walk-in clinic. It proceeded to get so bad that I couldn't swallow and I was vomiting up whatever I ate, but I was determined that I was just being a wimp over the whole thing. My sister came home, felt my forehead and immediately called our grandparents to take me to the hospital. I sat in the air for 4 hours because she made me take an all-in-one sort of thing for sore throats, which also included reducing fevers, so the nurses probably thought I was being ridiculous. Turns out I had cellulitis in my uvula and it had swollen to 3 times its usual size. Don't know how I got it, but work sure was thrilled about me calling in sick for a whole week during busy season. There's a difference between your soft palate and your throat, and that definitely makes a difference when doctors are trying to diagnose you. The patient here went to the doctors for minor tonsillitis. However, I had been getting it quite frequently, and he recommended getting my tonsils removed. So I arrive at hospital to get my tonsils out. Surgery happens and I wake up in my bed struggling to breathe. They insisted that I was just tired. I tried to get out of my bed and instantly collapsed. A nurse rushed in and started doing her vital signs. Turns out I was breathing quite frequently and heavily. The doctor comes in and checks me and over again and finds out that during the surgery I had pneumonia, and as a result my lung had collapsed, leading me to stay in hospital for another 2 weeks. Thank you for watching Internet's Funniest. Please like, share, and subscribe.